Okay, we're here today with David, and David is about to start his treatment with Dr. Davis. Now, David, you came to us for knee pain.
Correct.
How long have you been experiencing that knee pain?
Since February of this year.
Was it due to a slip and fall or any kind of traumatic injury?
Yeah, I stepped on a hose for a vacuum cleaner in my laundry room, and ever since that day, I knew something was off.
Right. Did you go get any x-rays done on that to see if you hurt it, or?
I've had x-rays and MRI done.
And what did they say?
The x-rays, he told me that he looked like arthritis or bone spurs in my knee, and then the MRI was confirmed by him to be a torn meniscus.
Oh, so you had a torn meniscus.
Right.
Okay. All right. So did they want to do surgery on it or anything?
Well, I haven't been back to him.
You didn't
come
go
here
Yeah.
because I don't want surgery.
Right, right. So what is a typical day like for you? Like, I know your job, you're walking a lot.
Correct.
And you said you walk 6 or 7 miles a day.
Right.
So constantly on your feet. So what is it like when you get home from work? What do you do?
It's a lot better than when I'm at work because I can put my leg up on the couch, or I'm not moving around a lot.
Right, right.
Yes.
All right, so I'm going to have you do a couple different things for me, David. I'm going to have you just stand up for me. Okay. Did you have any discomfort doing that?
No, a little bit in this knee,
Where did you feel the discomfort?
but right here.
Okay, above your knee?
Right.
Okay. All right, I'm going to have you take 2 steps forward. All right, I'm going to have you put your feet shoulder length apart. Arms out in front. And I'm going to have you squat down for me, keeping your heels on the ground. How low can you go? Squat down. There you go. And then slowly come back up. Where did you feel that at, David?
Same spot.
Same spot? Okay. All right, I'm going to have you go up and down the stairs for me. Okay. All right. Okay, David. So which was worse, going up or down the stairs?
I think going up.
And where were you feeling in that same spot?
Same
That seems to
spot.
be, that's your hot spot right there.
Right.
Did you happen to notice if it was when you were putting all of your weight on and pushing up to the next step?
Yes, it was.
That's
like
when it
right
was.
Now, when I come up like that, I can feel it.
Even just lifting your leg like that now is hurting. Okay. All right. So we had talked earlier. Your discomfort level today is at was it a 5?
Yeah.
Yeah, it's at a 5
Well,
now.
most days it's an 8.
Okay, but today you didn't work today, did you?
Right.
So
I was
it's
off it all day.
so you were at a 5.
Were you a runner?
No.
Jog?
Treadmill.
Treadmill? Okay. 1 and 2, 3, 4, 5, 6, 7 to the floor. Deep breath. And up. You got it. Pull. 3, 4, 5, 6, 7 to the floor. Okay. Deep breath. Go. 1, 2, 3, 4, 5, 6, 7 to the floor. All the way down. All right. Good job there.
Go ahead, pull. 1, 2, 3, 4. Come on, a little more. 6, 7. Okay.
Good.
One more. Ready? Traction.
Yep.
Go ahead, pull. 1, 2, 3, 4, 5, 6. Pull, pull, pull. And 7.
Okay. Yep.
All right, go ahead, pull. 1, 2, 3, 4, 5, 6, 7.
Excellent. Excellent.
One more, one more. Ready, traction?
Yep.
Alright, go ahead, pull. 1, 2, 3, 4, 5, 6, 7.
Good.
All right, we're back with David. David's finished his treatment with Dr. Davis, so let's see what you got. Stand up for me, David. Ooh, how was that?
That was good.
That was definitely quick and speedy.
Right.
All right, feet shoulder length apart, arms out in front. I'm gonna have you squat down for me, David. Ooh, and that was faster too. Down and right back up. All right, let's do the stairs. Oh, David, that's awesome. You're definitely walking smoother too. You seem
Right.
like your movements are a lot smoother.
I didn't need to use that handle, only the first.
Right, and there's no hesitation. I mean, you just boom, up and down the stairs.
Right.
Didn't even have to think about it. So you were at a 5, and what do you think it is now?
1.
Yes, yes. Are you happy with today's visits?
Yep.
Welcome aboard, David.